આ છે ને આખો એવું તો લોકોને ખ્યાલ આવ્યો કે ભાઈ વોટ આર ધ સિમ્ટમ્સ ઇઝ રાઈટ, કેમ કે ક્યારેક એ બધા ડિસીઝમાં આપણને ખ્યાલ જ નથી હોતો કે વોટ આર ધ સિમ્ટમ્સ ઇઝ ઓર હાઉ ટુ ડીલ વિથ ધેમ.
આપણે રસ મળીએ ત્યાં બી આપણા માઇન્ડમાં વિચાર આવે ને કે આમ હશે ને વી આર કોટ ઇન અ ડ્રમમાં. આપણે પછી એ વ્યવહારિક કંઈક આપણે કહીએ કે આવું હશે પણ reality is very different. They look at it, even the factors હોય, but they look at the real problem.
Right.
That I think is unique.
तो स्पीकर को साइड में रखने वाला जो है ना मोड उस पे रखिएगा ताकि वो रिकॉर्डिंग में वैसे ही आए.
हाँ,
सब
मैं अभी
नहीं
कर ही देता हूँ.
हाँ, सब ना दिखेगा, स्पीकर दिखेगा.
हाँ, देवेंद्र भाई, if you, I can do it only spotlight if you have your camera on.
મારો camera on જ oh there you go. Off it off right.
Okay. ના, ચલો તો મેં તમને સ્પોટલાઇટ કરી દીધા છે ને we can
Okay. We can start, ne? Tell me when to start. બરાબર
છે, we can start.
Okay, 8:01. Okay. Hi everybody. So you had wonderful talks all along, but the last two talks related to anxiety. So today I'm going to cover two topics just because then we'll cover a bigger area. So the first part is going to be the role of yoga and meditation in anxiety. Again, I've only picked the randomized controlled trials because they're the highest level of evidence. There are many, many studies that are also very good, but they won't hold that banner, so that it's better to learn these, and then you've got some idea of where the world is in this setting. So this is important, very interesting talks. We understand more about anxiety. We use anxiety in different ways, as I'm anxious today because I've got to talk to people. And then anxiety, which is just, something happened and you're worried for a few days. Then there's a true disease. And so we're going to talk about all of them. But what Anuja really did well is to tell us true diseases very well, which is the different types of we had. So keep that in mind. So we're going to talk about like that. So why would anxiety be accessible by yoga and meditation? Why would you even think about that? Well, if you look at the left side, you have the image with fear, and prefrontal cortex is kind of worried, which is your frontal brain. And then your amygdala is kind of where your reaction is. It's a key part in this. And that kind of sets you up to be very anxious. So it's overactive because your fear and worry is pumping there. Then you're going to have a very overactive part of that brain called amygdala. And then your frontal cortex is going to assess and see what reality is weak. So you keep building your worry. And then your hippocampus, which helps you understand and balance things, it shrinks because it doesn't have enough juice to grow, if you like. So this is basically what anxiety looks like in the brain, okay? And why it makes sense is, well, yoga meditation in different studies, what's called mechanistic studies, measuring the neurotransmitters, messaging, the shape, the size, and different aspects of what improves in your brain. We know that it down-regulates the amygdala, so it calms it down. So in the amygdala, there's less brain because less work, less effort, less panic, right? So therefore, it's not overly looking for problems. It's kind of calm, so it has more time to respond appropriately. So that's one thing yoga and meditation does. It also strengthens the prefrontal cortex. So if you watch people meditate for a while, you'll see the prefrontal cortex is thickened, thicker than others, which is more nerves and more ability. And it helps you regulate emotion. If your prefrontal cortex doesn't work well, you could confuse yourself, stand up, go to the corner and think you're in the bathroom because it doesn't regulate things. It can confuse you like that. When it's working well, then you're sharp and you can do things in a proper way. So yoga strengthens that in the science sense. We know, of course, from ancient wisdom, but we've had measures in science to show that that's actually happening. And then the volume, the hippocampus is the one that's your memory resilience that helps you kind of, if you like, plan and coordinate your action better. That one also improves with yoga. The size and its shape, you can see different in people who meditate regularly versus who do not. And good memory, so you can actually bring your memory to help you rather than panic every time. And so you get rewiring, and so that's kind of what makes sense. So you can see why yoga meditation should help. Good basis. And the other thing it does is the neurochemicals we talk about. The chemicals are ones that are messengers between your nerve cells and your action. And there are quite a few, you've heard of them. And they're kind of monoamine. She mentioned the monoamine oxidases. They're like monoamine, one amino acid, one amine. And they all are used by your nerves for different purposes. And one of which is GABA, GABA is the one you hear a lot about. And in stress anxiety, you have excess glutamate and your GABA is less, right? And we need that. GABA is very, very important. If you have more glutamate, you're very excitatory, very easy to trigger a fight or flight response, right? And then you get overactive HPA axis. Now, we've done the HPA axis before. We've talked about both the vagal nerve and the hypothalamic pituitary adrenal axis. And if you remember, what happens is your hypothalamus, right, gets pituitary sends hormones, which send message to your adrenal gland, which makes cortisol, which is a measure of your stress. So anxiety does all of that. And we already know we can address HPA axis. We already did that for other diseases. So if I do yoga, my HPA axis is calmer. But this is going a little higher than that. It's a step above that yoga works also. So it's the first time we're touching the level above, which is where your messengers are controlled in a way that's beneficial, right? And what does yoga do? Well, it does exactly the opposite, right? It will inhibit, right, the neurotransmitter. It reduces your glutamate, which is the one that makes you very excited, and elevates your GABA, which is what you want. And again, ADHD is the same thing. This is the same thing in ADHD, which helps. So it restores your balance. Now, this is a different balance to your ping line Ida, but in a way similar, but a different level balance, which then can manifest into your other balances off. But this is at a smaller level. And again, you rest and digest helps. Reduces your cortisol, right? So yoga does good rest and balance, particularly, let's say. And you get a GABA spike. So just to 60 minutes of yoga, you get a good 27% increase in your GABA levels in the thalamus we talked about, which is very close to the amygdala in level that's measurable. So we know that happens. Suppresses HPA axis, which we want. We knew about that. And the end result is you reduce anxiety and stress, right? So it's very important. So even at the structural level and even at the chemical level, yoga has scientific studies showing benefit. Then we go to the next level, which is my DNA in the cell. What does my DNA in the cell do? Every cell in my body. What does that do with yoga or in anxiety? So on the left side, anxiety is something called NF-κ beta. It's NF small kb inhibition, right? And what happens is chronic stress, right, affects that. What it does is it sort of makes your system more prone to react at a inflammation level. First with stress, hormone, anxiety, this is more at the inflammation level. So I'm more ready to get inflamed at the tissue level, right? My cells can attack more, fight more, fix more. There's more inflammatory burden. And that inflammation, same thing you do when you get sick, you get inflammation to get you better. It's useful, of course. The same thing that if you do too much inflammation, you get sick, like rheumatoid arthritis, and that many illnesses are because inflammation is too big. It's helpful, and then if it's too big, it's hurtful. So NF-κ beta controls that. And chronic stress will affect that adversely, so your response is poor. And so your genes, which cause fire and fuel, the pro-inflammatory genes, the arrow here with the flame, right? They're active. And so DNA changes so that the ones that are active are operational and the ones that calm it down are put to sleep, right? So it's quite useful. Now, if I meditate, I block that signal. So I am now reducing the response in FEB-beta, which is helpful, which my body is now more calm, the blue of calmness in the face, so it's more calm and responds more appropriately. So I don't overreact or inflammation. Don't set my weapons out right away. Don't start attacking things right away. I'm doing a better job. So all of this has been measured, including studies we've done. We've shown these with work with Samnichi at FIU, right? So so meditation, different forms, particularly more meditation, yoga perhaps, has shown this improvement. And the other thing it does is when I'm very anxious and chronic stress, my aging process speeds up, which we see that, right? Anxious people look like wrinkled skin and the hair color changes early, the stress is visible in them. That's because the cell level is happening. And the telomeres, which is a measure of how long you're going to live healthy, if you like, or length of life, is aging faster. With meditation, prolonged meditation, not going to happen in a week. If you keep persisting, we know that that's restored, and you are younger at older age. So again, in Jainism, of course, Ayush is fixed, let's say, but you'll be healthier and younger in effect until that age. Okay, and your resilience and ability to respond to things is better when you have a longer telomere, right? So very important. So longevity goes up. All that yoga does, you can see why it helps. And then lastly, so what? So if I have DNA, RNA, what do my cells see? The chemicals do the act. Like in the brain, we had these neurotransmitters. We talked about the GABA and the glutamate. They're chemicals. What happens in general? Well, in general, when you are anxious, your lipid, your fat metabolism is quite messed up. Yeah, and you release agents, and so you're inflamed, and your whole system is set in a more allowing you to damage your body, trying to defend from something which is not there. It's just your brain saying there's something there. Your stress is trying to fight a tiger or something dangerous, but there's nothing there. So you're burning something, but there's nothing to sort of use it on, so you have damaging yourself. Yoga does the opposite. So it reduces the it's not spelled properly, maldehyde. It reduces the MDA. And so that reduces my stress at the cell level. Stress is a big term. I'm a stressed person. We talk about at the cell level, tissue level, there's also stress. It's just like a medical term. And that stress, which does relate to your stress in some way, but that stress is lower. So your cell is calmer and not in attack mode, it's in resting mode and in function mode. It does more building, creating, and helping rather than using everything to attack. You know, it's like a country putting everything in military force to attack. Well, there's nothing left for the people. This is what happens. Okay, and the amino acid, which is what makes a protein, that's also changed. So tryptophan, which is a common one, it's a big one, good one to remember. When you do yoga, right, it optimizes that, and it's a calming, feel good one to returning. It's a good one to have, and otherwise you will waste that, right? And in panic attack, you'll get high lactate. We know about this. Somebody else talks about how when you do some yoga, you should always rest, or yoga tells, because you want to let your lactate acid in your body, which have the toxins, settle down. And if I'm high energy burning, I'm going to create more of that. So at that level, even meditation, we know can reduce the lactate levels and reduce balance energy, anxiety signatures better. Okay, all those reasons, which are many at different levels, right, show you why it should work. And it turns out that it works. We already heard from Anuja that even the American Psychiatric Association recommends yoga. It's not like some of the others say it may be good, it's good for you. In other diseases, we have different level of recommendation. Here it's a strong recommendation, high recommendation. It says that one particular form of Pratyahara, if you like, mindful-based stress reduction, has shown that is as good as medicines, right, for anxiety. Like one particular medicine, Algepro, Lexapro, in the study it shows as good. So you have options. So their guidelines to integrate that into your yoga and medicine yoga to help reduce stress. Of course, culturally aware, people want to do it, all that, but it's a recommended therapy. It's not just, okay, do it, might be good for you. It's actually specifically good for you, right? Again, same amygdala, right? Reduced activity. The studies with this have shown that the same area it calms down. And just to highlight how big this is, the American Heart Association also, not just because of heart MI we talked about, but also because of reduces stress, also recommends that. In their studies with hearts, they use transcendental meditation. Just because whoever did a study, like we would say we go to Praksha Dhyan, then it'll come up Praksha Dhyan does it. So doesn't mean the others won't do. They just report which methods that we can go back and understand. And so they did the 4-7-8 breathing, which is kind of like box breathing. And in that study, they used this particular transcendental meditation twice a day, right? And so they found it work and they recommend it. Autonomic nervous system is your Ida and Pingla. This is exactly what that is, and which we know very well it can work. The UK one, NICE, which is usually much more stringent, also found that for mild to moderate anxiety, you should include these therapies and mindfulness as part of your low intensity intervention. The only thing they mention is that it's not completely conclusive yet, but they recommend it. Okay? And then the National Institute of Health in America also recommends that. And for mild subclinical, and for formal anxiety, they feel that you should use as adjunct, not make it primary. So you be careful what you offer. They should go to the doctor, get the treatment. You add it is what they recommend. They say that optimal dosage is about 90-minute sessions, 3 times a week, which is not always possible, but this is optimal. And usually about 3 months or more seems to be necessary based on studies. And they talk about the same components, asanas, pranayama, meditation, and some practice at home. Only thing they mention is that some practices in some of the studies, particularly headstands and kapalabhati, can sometimes trigger a panic sensation. So they're saying be careful with patients of yours who have a panic form of do slowly or be careful about that. Okay, so these are the highest recommendation in the US that you can imagine. So we don't have to worry about the data, but it's just good to see data. So one of the studies I quote is this one, which is Mind. The MBSR, we talked about that. This is the one we just mentioned. Is the method that is recommended by the NICE, and also is recommended by NIH. And we talked about that from the American Psychiatric Association. They also recommend that, right? So in that study, they've had about 276 adults with generalized disorder, the panic, and the social anxiety where I cannot go out. I'm scared to go to meet people because I sweat and I'm very anxious. And then compared with a well-known drug that works for that to see how it works. And in both groups, they saw reduction in anxiety, so it worked equally, so it both are equal. However, what they did see is that the intervention day would take about 8 weeks, right? And for them, it's 45 minutes daily at home rather than 90. So this is a study that's one of the studies they quote in those to say that it works. And what they did is gentle hatha yoga, but focusing on the body awareness. They did Tadasana, they did Vrksasana, and then side stretches, a cat-cow, child's pose, and recline twist. And they did mindful breathing, very much what we do, so the natural breath. And they did the 45-minute body scan. Kartsag is pretty much what this would equate to. And there is sitting meditation. So it's alternated that with focused breath, which is pranayama, and walking meditation. And they had also did mudras, the Gnan mudra, and something related to that. So this is a protocol and it's available and you can apply. And good data. Another study for panic disorder. This is the one where they are panicking. They can't go to the house. There's a panic. Different version that Anuja had explained to us. Yoga is an add-on to standard therapy. They used it in 64 patients. Again, a control study comparing 2 methods. And the anxiety score plummeted from 49 to 13, which is extraordinary. It's 2 steps down, which also we find in our studies that the level of anxiety, not just 1, but 2 steps below, it drops that far. And it was a substantial effect. And that was for 12 weeks. So we find this in our clinic also, that the effect on anxiety is quite profound. And their method was the loosening, which is the micro exercise or the subtle exercises. They did the micro movements, and then Surya Namaskar as the warm-up. Then they did the similar poses, Sudhasan, Padmuktasan, someone got shoulder stand, Dhanurasan, and spinal twist. Pranam Suprastrika, Nadi Shodhan, Pranam, and then Brahmari. And they did Anapana, which is, of course, observing rather than Nadi Shodhan. It's more observational, which somebody teaches us. And then they did the mudra, particularly chin mudra, in that study. And then another study used Kundalini Yoga. Again, a good study, large sample size, 226 adults, about 12 weeks. And they found that Kundalini Yoga compared with the normal, which I mentioned was the CBT, the cognitive behavioral therapy, which is the standard therapy, the recommended one. They compared those. And here you can see that CBT Kundalini Yoga, there were slight differences, but not too much, and better than stress education. So it showed that it works, and therefore it's recommended. Again, it may not be the primary therapy, the only therapy, but it works. They use spinal flexes, Sufi grinds, and frog poses, and then segment breathing. So this is like your box breathing, and your Agni Pran, which is where you lean forward, and the breath of fire we did. There's some chanting, and they also did mudras, but theirs was like sequential, index, middle, ring, pinky, and they do kind of sequential, some version of mudras. And they did long shavasana and guided visualization, which is very close to our Kartsang and visualization, right? So overall, it's very helpful in mild to moderate, and in severe it can be an adjunct, okay? And even if you're very mild, the supplement is really good. Even if you think you've got mild anxiety, do this, it's actually very powerful. So in fact, works really well there. You're not necessarily be diagnosed when you see a doctor, but you sense that I'm getting a little bit anxious with things I shouldn't be, then it works really well. It reduces symptoms, and you get the other benefit, which are subclinical, which are very important. And then there are many therapies, meditation, mantra, mindfulness, and most have worked. I think mindfulness or the praksha seems to be one of the central part of all of them. That seems to work. I will summarize that. All right. So key takeaways, all right, for us is that dose matters. For mild anxiety, the total hours practice is the strongest predictor of success. So if you can do more, of course, it makes sense. While the cognitive is excellent for logic based, so I don't worry, I know what I'm doing and why I'm doing it. Yoga does the heart side, and it does the medical side. So yoga is more powerful for the low heart rate, the variability, my cortisol reduction, my general body calmness. So you can see why both can combine and help. And in some ways, yoga may be better. In safety, of course, it's low risk of anything. Really no side effects like drugs, as you know, with some caveats. Now, the only thing when you practice, if you see a patient has severe anxiety, general anxiety disorder, then be careful that you see the doctor and just use yoga as an adjunct, not replacement, right? Also, it turns out that when you focus on an exhalation in your pranayama and you lengthen the exhale, that seems to be an important part, so that longer time to exhale seems very important part in why that works in the studies they did. Again, related to parasympathetic, remember? Same thing, autonomic system. And then consistency is better rather than a lot. So you want to do it regularly. This is what their study shows. So they're suggesting these tips to have best effects. Okay. So that's anxiety. Any questions? I want to pause and I'll see if anyone wants to ask any questions on that. It's the most evidence-based, if you like. The data for this is the loudest, where it actually should be used, not optional, but it should be used, as opposed to others who can use it. So I feel this is a very, very important concept to pass to your patients, that this is a part of the therapy, important core part of the therapy.
Yeah, Dr. Devendra, I have a question about the lasting effects of yoga and meditation. So the effects are clear. It reduces anxiety, but is it only during the practice, or do the effects are they more permanent? Epigenetics, you mentioned that could be a little more longer lasting, but is there any evidence or research in that?
Yes, they have. So generally, two things. First, you have to do it for 3 months or more to
Right.
really see the benefit, which makes sense. Second, that yes, if you, knowing from the epigenetics, even if you stop it for a week, you'll still probably feel well, which is a trap, right? You feel, because the benefits are set in stone, but they will decay obviously at some point. So the trick is to maintain, right? So as you mentioned, remember the studies I presented last week, that even where it works in disorders that we talked about before, what happens in those studies, which you can learn from here, is that when they're consistent, a year or two later, it still works. But if they're not consistent, then the effect wanes. So yes, I think the answer is that yes, I can probably stop after 8 weeks, 2 weeks. I'll probably feel good because my structures and epigenetics are still working, but they're going to decay with time. So I do think that you have to persevere. I didn't see studies whether it needs to be same duration, where you can reduce the amount and still work. That probably requires more studies. You could probably get away with doing it a little less because I've done it for a while, maybe. But those would be a good question to ask. But I think this would be a lifetime change. Don't forget, these are diseases, right? So
Yeah.
you want to make it a therapy where they don't need drugs later. So
Yeah.
I would say it's lifetime. Keep on it.
Yeah, the lack of side effects is a great incentive in itself. But if there are, lasting effects of yoga and meditation, that could be an added incentive. Okay, I just need to do it for 3 months consistently, and then I'll have, long-lasting effects of it. That could be a great incentive for younger people, because it is an effort, and to bring them to do this. But if they know that they have to do it for 3 months or 4 months or whatever the minimum period is, and then they can either reduce the medication or even get rid of it, with all the side effects of those medications.
Yeah. And to your point, like, let's say I'm an anxious individual and I control it 3 months later, I probably have more insight, right? Now I'm more able to understand, kind of do the cognitive behavior by myself, because I now understand better, and I'm in a better place. So I think definitely I agree that you probably could do that and still benefit. Just You couldn't promise that. The data is not there yet. But it's a wonderful way to message it, like you're saying. I think if you message like that, their effort and time, they'll feel rewarded, because reward comes slowly, right? The only thing about yoga is that you won't know for a couple of weeks the feeling, whereas a pill you might feel tomorrow. So that's something that you'd have to build that trust. And the data card, this data, of course, hopefully we'll finish our cards and we're working on the first one. Those things are data driven. You could use that to convince them, because they'll have the material at the fingertips to help them have the trust also this is going to work, which I think is also important.
Right.
Yeah. One thing just to add to that, and add is, if we ever start medication on patients with anxiety or depression for that matter, we're usually telling them when we start that you're probably going to be on this medicine for at least 6 months. It's not like 3 months or 4. It's actually, we say 6 months before we start seeing, can we start reducing it and seeing if they are still okay off of it. And during that time, they're receiving all behavioral therapy. They should be receiving behavioral therapy as well, or cognitive behavioral therapy. And so that actually makes them think differently and puts their mindsets differently, so that when you come off the medication, you are still staying in that same mental framework. So you're not feeling anxious anymore. Your anxiety's gone down. So I think with yoga and meditation, I think it could be the same way. We're actually not using medication here, but we could say that, if you did it consistently for, say, 6 months, things will change in the way you're managing how you look at a situation or approach a situation. And then because you've learned that technique, or you are managing it that way from now on, because of the yoga has affected your neurochemicals in the brain, you're not anxious anymore in the situations, then you continue to be that way afterwards. And you don't have to continue it lifelong. Because I think to say lifelong yoga would be a hard thing for someone to swallow. If that's the only thing that's going to make them better. I think it's at least we say that, okay, this much time, once you start feeling better, you can start reducing it and things like that. And we reduce meds as well. We don't come off them completely. So you can say, now you can start doing it a less frequently kind of thing. I don't know.
That makes sense. The other thing which just occurred to me while you were saying that is that when we teach yoga and you do this 20, 30 minutes for a day and you do it and get better, when we actually use it, we usually give them, even in cycles, give them a response in the acute setting. For example, when I'm feeling the panic right now, what do I do? Mm-hmm. So deep breathing and things that somebody teaches us, we could do that. You know that you're going to get control over that. Well, they're in a better shape to use that. So it may be a combination. It's not, this studies just do this because they're comparing the drug. But then, you have techniques that help you moment to moment. I'm doing it 20 minutes in the morning, I'm going to work, I'm doing it, but I have an anxiety moment, I can't find my car. Oh my God, where's my car? It was stolen. I get an anxiety attack. Well, you've now acquired that skill. You know how to take deep breath. You know how to calm down. You know how to
Correct. So you can do it at that moment. Yeah.
And that's hard to study, but I think that can be just as important piece of this, where moment to moment,
yeah.
Managing my anxiety base level, but I have a one. So when we went to a course in Harvard, the Harvard Benson Institute, they did that. They teach you a regular yoga package, let's say, for something like this, and then they do a 2-minute, and they give you a card, a 2-minute package. And so it may be deep breathing, things that we're doing. So you then give them that. There's a card for 2 minutes. So when I'm in a state of panic, whatever the condition is, and I have a card for my daily activity. And I like that approach because you kind of have the immediate response as well as the long term. And there may be studies on that. I didn't see in RCTs, but that's what they recommend. I feel that's a good way to think about this also. So it's not just compared to medicine. You may have something even more beneficial. And the medicine only affects that pathway. Yoga affects generally, as so many other things. So you can even sell it at multiple benefits. It's not just that drug. Forget the drug side effects, but you now got all the other benefits: cognitive, my medication system, my other outlook to life, right? So I think a lot to sell. I think, and then I think Naya's right. If we don't overly say lifetime, probably is not the right word. You could get them, you might lose them. So you get them for 3-6 months, and then they can decide,
They can decide, make it.
They can decide what works for them.
Yeah.
So good discussion.
Thank you.
Anything else? I've got just a few slides of obesity. We can still go back to this if it comes up. So it's not we can go back to if questions come up. All right, so obesity, we didn't really do as a talk because everybody knows about it. It didn't feel like we're going to waste a couple of days of just talking about obesity in terms of diagnosis and treatment, just because I think it's enough out there in the media. But we want to just touch on how yoga can help in the data so that we cover it, because it's a very important epidemic clearly worldwide. And Ramesh is going to cover the poses for this. So obesity clearly has a lot of issues. And one of the things is that why would it work? So the neuroanatomy, right? Your anatomy in the brain is set in a certain way because you have satiety centers, insula where you feel full and every say, okay, I've finished, right? And then if I stop eating. So what happens is, it may or may not be abnormal. Clearly it's abnormal in some sense, I'm overeating. But we know that yoga and meditation will help that. It increases your gray matter in that area. And so you can give an early signal to your system that I'm full. And therefore you would eat less. So yoga does that accuracy of the signal and knowing exactly when you're full and say you can stop now, where if that's not working properly, I'll overeat, okay? So this is one thing yoga does. Again, data and studies, as we talked about, there are more mechanistic studies. The other thing is the same prefrontal cortex, with prefrontal cortex about anxiety, the same one, we know it improves. And that is your impulse control. You know, I want to do something, I woke up and said it's something I didn't want to do. Well, I was dopey and my prefrontal cortex wasn't operating. So I did something that ordinarily I would not do. You know, just a dream, or just saying an example. And, you know, we often are not fully awake, then we might say, think, or do something because our impulse control at the front isn't fully operational. And in obesity, it's not working well. That's why you overeat and you can't stop yourself. So that stops, that's a break. So yoga, we know improves. We already talked about it for anxiety. It's the same area benefits here, right? And so you're better control, even when you got the very tasty food, you got better control. You can stop because it's more functional. And the hypothalamus, again, which is where the weight sits. In hypothalamus, you have a set that says to your body, I want to be this weight. And messengers come back and forth, and it'll push you to keep eating and staying at that weight because it thinks that's your best weight, right? And we have hormones called leptin and insulin that work through that. And we know that specifically with yoga, that set point is changed, right? And you set it properly. So you've got a better ability to control your weight set point, so you can control that. So you reset the point, which is hard to do. You know, to reset a point takes slow process, won't happen overnight. It's a hard thing to do. And but yoga can do that again when you do it for a few months. So this is all data driven. It does work there. And then we have the same neurochemicals we talked about, the balanced appetite and reward. Again, these are other hormones. We talked about the ones affecting anxiety, the other ones that work. We know that your leptin, which is your hormone that says I'm full, it controls how much I eat, it optimizes that. It reduces my drive to consume excess food, right? And my ghrelin, which is the one that really pushes me to eat, I can really do well at lunchtime and tea time, but the ghrelin will push me to be really hungry because it thinks that I need to eat enough to keep my weight up. So this ghrelin is the devil, really. It'll make you eat, and doesn't matter what you do, you'll succumb, right? That's why weight loss by willpower is so hard, because this ghrelin will overcome you, and you'll cave in thinking, okay, today it's fine, you know, I'll not do it tomorrow, let me just eat today, and boom, you're back in trouble. So this is what makes us go crazy, this ghrelin. And then the dopamine, we talked about that a little bit. We talked about GABA, but dopamine is related. Again, that is also in yoga, we know that your natural dopamine release, increasing that satisfies your reward. So you feel rewarded without the sugar drive. If you eat food that provides that drive and you feel rewarded, oh, I feel better. I feel nice, I ate, I feel that nice, warm, fuzzy feeling after a meal. Well, with meditation, that is already in a better place. So you don't need that food to do that for you, okay? And then we talk about serotonin, which is for anxiety, and it's also for emotion and mood regulation, right? So here we have low serotonin, right? And that's a problem with obesity. And then as I address that, I have a drive to overeat to kind of balance that. So my overeating kind of way to keep that high and temporarily make you feel better, regulate my mood. It's a hard, vicious cycle. With boosted serotonin, which meditation does, yoga does, I feel more root cause. I'm a little bit more basically content. I don't need the drive for emotional well-being and mood. I'm already in a better mood, so I don't have to use food to help me. Okay. Same cycle with smoking. So same cycle with alcohol, same sort of cycle. And then at the epigenetic sense, which is obesity sensing genes, before yoga, we see again the same lipid pro-inflammatory agents from fat, which we talked about a little bit in the anxiety. The same ones we create low-grade chronic inflammation. I'm chronically inflamed, right? The NFK-beta we talked about is dysregulated, so I'm chronically inflamed. After yoga, I calm that down. And so I'm not inflamed. My system is working more smoothly and efficiently. And so I move on then to a calmer state. My DNA is calmer. and my stress gene interaction improves. So before yoga, the same HP axis we talked about is awry. It's kind of increasing cortisol, driving my hunger, appetite, I'm eating more, my mood is down, I eat more to make it better. I'm in a vicious cycle to keep my mood up by just eating. It makes me feel good temporarily. And as you locked into that, after yoga, you are now better, right? Same thing we talked about, axis is better controlled and closer. So some overlap in anxiety. That's why we did it together. You can see there are a lot of similarities, okay? And then the metabolome we talked about, again, the metabolic thing of what are the chemicals released from your cells based on your state that you're in. And before yoga, some of the fast-built low-density lipoproteins, right, are in storage mode because your system is stressed, but in a funny way. So you're high insulin and you're not responding to insulin, which we talked about before with diabetes. You start storing your fat, right? And so instead of burning it, you're eating and you're storing it. So you don't see it. Your body doesn't see it. So you keep eating more, and that cycle is awful in people with high weight issues. And when you do yoga, you do a better oxygenation. You're better able to address that, and your HDL goes up, right? And now you're in a use mode, and so now you're in a better mode where you can, instead of storing, you can burn, which is what you want. More active, more zip, more get up and go, more small subtle things, and you start using your fuel properly. So this kind of why when you do yoga, in fact your lipids do improve because of this pathway. We talked a little about insulin. Before, insulin is resistant, it doesn't just work, your body ignores it. That's one of the key things in diabetes, also in obesity, which leads to diabetes. Very similar thing at a slightly different level. And so when insulin is inactive, you're storing your fat, not burning it. It's kind of stored. When you do yoga, it seems to improves. So I'm more responsive. Again, we talked about diabetes. And glucose is better burned. So when I burn it, it doesn't cause damage. My fuel is not getting stored and clogged up, clogging my cells is being used and appropriately used for fuel. So this is the same thing. And then the stress, my cell stress is more stressed because of all these issues and the MDA we talked about. And after, it's calmer and glutathione goes up. So the same process that helps anxiety helps here in a slightly different place in your cell in the body to reduce your stress and reduction. So you can see you're in much better shape as an individual to manage your hunger, the appetite cues, and your body's calmer and less reactive. So all that is data-driven. All that's been studied, right? So what did we find? Well, in this study in 2014, they found that if you yoga and walking, right, you compared and before and after, you saw a difference in both, but yoga was better, right? So about 15 days yoga was a group that did walking. They did diet also, and they found that the difference was like that. And you know, of course, you adjust for the start, but the difference actually is slightly better. So 60 women with abnormal obesity, and they looked at 2 sessions per week, 90 minutes for 12 weeks. And the waist circumference dropped in yoga group more than the walking group by their circumference, which is a body fat they don't want, improved substantially. So they found it safe and effective in yoga in using that fat. The asana is again a mountain pose, triangle pose, which is a key one in obviously that seems to be a key one that most studies use, and the warrior poses we did, and then some flow-based stretches that are yoga plus also the subtle exercises. And then pranayama we told, of course, which is Kapalbhati and the Anum Vilom, and focus attention on breath during a relaxation phase. They use Chin Mudra during seated meditation. As we're meditating, they added the mudra. So this is a protocol that's a validated one. And then they had a one for male obesity, another study. And in this one, they also did about 72 obese men. And they were randomized into a yoga group and with 90 minutes a day, 5 days a week, slightly more intense. And they're followed for 3 months with assessment at 2 time points. And they found weight reduction, which is impressive, but stress was also less. And most of them started at 3 months after. So to your point, I think that whether they did it or not as much, the benefits were still there 3 months afterwards. Right, and then the comprehensive yoga therapy is effective, is a conclusion. They used this Suksma, the micro exercise we talked about to start with, then they did sun salutation, and then the spinal twist, Muktasana, and then they did shoulder stand. And pranayam, they did again Betsika and Nadi Chodhan pranayam. And they did Om chanting and cyclic medication, which I think we'll have to look up, but basically is a combination of stimulation and relaxation. Stimulate relaxation. Okay. And then another study in middle-aged obese women, they did, again, found combined yoga meditation will lead to, the theory was to lead to significant improvement in BMI, 12-week randomized controlled trial, and intervention who had the physical yoga and mindfulness meditation, and they found reduction in BMI about 8%. Cholesterol and lipids, which we mentioned, improved, which is good. HDL increased, which we theorized earlier, and the quality of life improved. It's a 12-week duration, and they use again Trikonasana, tree pose, cobra pose, and bow. And they had deep abdominal breathing and Brahmari as the pranayam. And this mindful meditation focused on non-judgmental awareness of body sensation, hunger scan use. So they use some focused meditation. And the results are quite impressive. These are impressive results. Okay. Good. And then they did another study where they compared yoga and walking. So that's another one that we just touched earlier. So summary, I think the asanas they used were these ones, Surya Namaskar, Tadasana, Trikonasana, Bhujangasana, Sarvangasana, Dhanusasana, and Padmuktasana. Pranayam the same, Kapalbhati. They find that's probably a good one to add, Viprasika, Anum-Vilom, and Brahmari. Again, you have all of these, and meditation, they used these particular ones with deep relaxation. Chin Mudra for focus, and Shanagat Mudra for certain relaxation. And the lengths were about 8 to 14 weeks. So very doable. Okay. And again, we talk about the intervention 3 to 5 sessions per week, 6 to 90 minutes. And in this one, the benefits were for 18 months. Right. So some of the benefits, psychological benefits like mindful eating can benefit for 18 months. It's after the first 3 months. But the weight benefits require ongoing practice to prevent the rebound effect. So this is a partial answer to your question, Rakeshji, that some benefits persist, but some require ongoing activity. Right. And so trainers obesity main tips they're saying is incorporate Kapalbhati and Bhastrika, as these two seem to be very impactful in the abdominal fat. It makes sense. They're burning, as somebody said, we're burning that fuel. And then integrating yoga with the things seems to work better than any one. And you address emotional eating, and then you try and do 3 to 5 sessions a week, and minimum 12 weeks to see significant changes, and then they might continue because they're seeing the benefit. All right, so that's both, and I can see the very strong overlap in both, and even to some point in the diabetes, but they're very similar. And I on purpose went to the boring pathways in the brain to see how powerful these techniques are. They're working at the level that drugs are being made to try and work at that level, and we already have this from an ancient wisdom culture. So I think you asked a question like that yesterday, I think, related to whether if we learn where these drugs work, can we target yoga for that? And I think the answer is yes. This is what this is doing. Exactly what you asked is happening. They actually, same areas are benefiting that drugs are targeting that yoga is doing. And then with practice and wisdom that we have, we know which ones work. We don't have to research so much, but then we can see how much we can research, do 1 minute, 5 minutes. There's some other improvements with time we can do and optimize. So, but wonderful studies. I think this is one of the disorders, both anxiety particularly, but obviously where the impact is very clear. Yeah. Even at the highest, most critical medical level of looking at it, they find it works. Mm-hmm. Yeah. So it's good basis to start talking to somebody where it really works. Look, yeah, they don't be great, the studies are hard to do, but look, it works here, and these are central to your illness. So this itself can carry a message of trust in the ones where the data is a little weaker, but any common sense person, well, it works here, yes, I think it's going to help me here. And I think you can use this and these agencies, which are well-renowned, as say, look, Heart Association says it, Psychiatric Association says it, You don't have a psychiatric problem, look, it's going to work in the same way. So I think you can use that to advocate for this and get them to be completely on board. Not just they like you and they think you're smart, but they actually have data that'll give them that additional conviction to pursue and stay on course. Okay,
Excellent.
good. Any questions? Anything else we can touch on?
Devendra, you just mentioned you need at least minimum 18 months for the obesity and 6 months for the anxiety. So anxiety you can do like in 6 month interval, then gradually then ask them to go for the lifetime. Is it not convenient that way?
Yeah. No, I misspoke that. What obviously you see benefits within 3 months. It's just that if you stop doing it, you'll see some benefits still 18 months later.
Okay.
So the effect is so good that effect will last. Even I just said it 3 months, I get my benefit, and I stop. I still see some benefit for 18 months more without doing any more.
Okay.
But 3 months is enough. But I think to Naina's point and our point, these are long chronic conditions. We probably should aim for 6 months, maybe. I like that. I think we can say, look, start to see benefit within a few weeks. 6-8 weeks to start seeing benefit. But 3 months, you might think you're there, but I want to keep going longer because it will sustain better. So I think from what we know, we could do that. The studies say 3 months is working, but we want a long-term solution, right? The studies are costly and they'll do it as short as they can and sure it works. But in real world, it's not like all the drug trials we talk about. Normally we stop after 3 months at work, and then you prescribe. It doesn't mean stop at 3 months. You have to keep taking it. Right? But the drug company only fund it for so long, and then the doctors have to help decide. So you guys like that. So I think, yeah, I like your approach that you do 6 months, see what happens, ask 6 months again. I think that approach would convince people. If you have benefit, come back, and then if you don't want to do it, don't do it. And then you come back and then we'll try it again. Yeah, I think any way to buy your benefit to your patient, you have to work with them. I like that. Good idea.
Very nice studies and results, and very nicely explained, Dr. Devendra Mehta. I have one question. Might not be related directly to today's lecture, but in general, the dopamine release after yoga and meditation and exercise, does it need a particular heart rate to get released? Because some of the techniques for yoga and meditation are lighter and does not require much effort. Maybe heart rate is pretty normal. So does it need any specific heart rate to boost it, or?
No, I think mostly yoga is about stretching and oxygenation, not about heart rate. Of course, as a warm-up in Surya Namaskar, you will get some heart rate. But I don't think much of yoga is about increasing heart rate. It's more relaxation, lowering heart rate. What it does do, and with links dopamine, is your variability in heart rate. So if my heart rate variability is high or low, is a measure of how stressed I am. Right. And so the measure, so if you take your EKG and look at your heart rate, you can see there's a standard kind of pattern, right? In some, it's fast and slow, so it's variable.
Yeah.
Right? The variability is your autonomic system not working properly. And as you meditate or yoga, that'll calm down. And then the dopamine effect is more in that part of the brain. So dopamine has so many actions depending where it is that you can't really always know where's a good guy or a bad guy, just like sugar. But in the areas we want it to work, it seems to vary with executive function, the areas where ADHD seems to work well. So it is a very important pathway in how this works in the brain. So, but it seems to be beneficial in the yoga sense. But your heart rate doesn't need to go up. It's more, and then your variability, you want to actually slow down. You want to less variability, more steady, just like breathing is controlled and rhythmic. You want a heart rate rhythmic. That means all your systems are balanced.
Got it.
If your sympathetic is not balanced, then your heart is going to go, it doesn't have to be fast, but it'll be variable. It could be fast, but at a low level, it's just variable. That's a measure of saying your sympathetic, your autonomic system is under control. That's one test we could do. If we did a study we're doing, the questionnaire, we could have done that. I thought about it. That would be hard to do if you did your heart rate variability at the beginning, and you would have seen the difference. It's that accurate. You would have seen in a certain time, close after me, you do your strip for like 5 minutes, and you do again after doing this, what we're doing, you'll find it'll be far calmer because your general sense is much calmer. So heart rate variability is a very good measure of your autonomic nervous system.
Got it. Thank you.
Okay, good question.
Great presentation. Nice explanation.
Good. I think you can. This is your pre-medical education now. You can be ready for the next step. Yes, Samriji, up to you.
Thank you, Dr. Devendra, for explaining about the research and all the details regarding the problem of depression, anxiety, and yoga on application of yoga for this problem. So thank you. All the times you are giving some very wonderful informations regarding the review research and also about the disease, particular disease. So now it is the time for meditation. Yesterday I have already said that I have done some experiments, and also I have taken some research. I have given some assignments to my students for writing on their problems. Then they have written mostly on anxiety and how the yoga has affected their life and helped them to come out of this problem. So they have written very well research articles on their experiences. So yeah, I can share all those documents if somebody is interested to see how anxiety and yoga is helping in the problem of anxiety. So now today, who is Dr. Devendra is giving, I think.
I can do it, Samriji. I'm not sure it's today, but I can do it if it's not. I can't remember.
Okay, so today who was ready to give the session? If you are not ready, it is not necessary because you have given already the lecture.
No, I was preparing, but I wasn't sure today. I thought it was maybe Friday, but because Thursday, I think.
Okay, Friday, Shachi has taken.
Oh, okay. Thursday, then I can.
So Thursday you could take.
Between Thursday, I can do
I
Thursday.
think you were doing Thursday, though, and Sachi is doing
Correct.
Friday.
Correct.
We didn't have anyone for today, Somniji.
Oh, for today there is no one.
You were thinking maybe
Somniji,
Sheeta might have joined.
I can do the remaining of the yoga ones.
That'll be good.
Okay, so that will be good.
Awesome.
Yeah, you can cover.
Yeah.
There are abdominal muscle exercise and also the backbone exercise.
And the cryosub exercise with the legs and the...
Correct. Okay, it is good.
So first, is it visible?
Very good.
Okay. First, we'll relax and stretch the body. So breathe in, and raise the hand, clean, and raise the hand while inhaling and on your toe. Gradually, when you exhale, bring the hands down sideways. Inhale. Inhale, palm facing upwards, and you want to stretch on your toes. And exhale. Relax. First, we do a few times inhale, exhale process. Inhale slowly, exhale slowly in the beginning. Now we'll do the waist exercise for that. So put your thumb and fingers at the back. Inhale and exhale. When you exhale, you bend 30 degrees. Uh, and then you move your stomach in and out. Facing your face facing the wall. Inhale, come back. Again, inhale, exhale, and bend now 60 degrees. Exhale, come back straight. Now we'll do 90 degrees. So inhale, exhale, 90 degrees. And stomach going in and out. Try to push your stomach touching the back part of your bone. Now inhale and try to rotate the stomach after exhaling and bending down. Or stomach going left to right, right to left. Then we'll do it in 60 degrees. Inhale, exhale, bend down. Now we'll do it 90 degrees. Exhale. Let's just check one more thing. Okay, Now we'll do the final one. So lying down on the floor. Put your left foot on the top, heel on the top of right foot, right foot thumb, and stretch your hand sideways and turn the legs on the left side and the body on the and chest and face towards the right side. Now reverse the process. Put the right heel on top of the left toe and turn it toward the right side, and your head and the chest toward the left side.
And in the left side. Turn in the left side. When you are putting right leg on left, then you have to turn in left side and your neck should be in right side.
The leg should be on the right side.
Correct. See the leg, which leg you are putting up, you have to turn on
Right leg.
opposite
Right
on
leg.
opposite side. Yes. So if you are putting the right leg, then you have to turn in left side. Okay, and the
Yeah.
neck should be in right side.
Yeah.
Okay. Yeah, that will be easy to turn.
Mhm. Mhm. Now put
So
this on top of the
which leg you are keeping up, turn in opposite side.
yeah. Now this right leg, knee, bend the knees and turn towards the left side, and the chest and the head toward the right side. And try to touch the knee, knee on the top to the base. Relax. Inhale. Bend the left leg. Exhale. And bend towards the right side. And your chest and the head on the left side. Relax. Now bend both legs. Bend towards the left side. And your chest and head toward the right side. Relax. Exhale. And towards the right side. And your face and the chest toward the left side. And try to touch Yeah, knees, legs on the ground. Legs. Mandami nama sami. Did I miss some of them?
Just I was thinking that I have already said, or because it was not clearly seen.
Oh.
Your video is not clear.
Mhm.
Okay, now, so might be you have done right.
Let's see if I can-
Now it is clear. When you were doing lying down, then it was not so clear.
Mm,
Okay, now you can you can go ahead. नहीं. Yes, you can go ahead. Yeah.
So towards the right side and chest and the head toward the left side. Come back. Change the leg here on the top of the left leg, toe towards the left side, and the chest and the head toward the facing right side.
I think the autofocus function Zoom is messing it up. It looks good when you start, then it focuses on your knees, so it doesn't. It's a Zoom problem. It tries to focus on an area. So you may want to put it another 2 feet away from you, then it might work. Because it's trying to Zoom as this new thing. It tries to get the best picture. It messes it up.
Let me see if I can do it.
Yeah. I don't know how to disable that, but every time you do it, it tries to zoom in. It's very annoying.
Yeah, it's getting fuzzy when.
No,
Yeah,
you
it's-
cannot, I think, because it's now become a default feature in a Zoom.
Yeah,
So
it is.
something we can do and something we can't.
Yeah. Ramesh, he does a good job. Somehow he does it. I'm not sure what he does. He seems to work well.
No,
But
because I'm using cell phone. Don't know whether it's not.
it's the Zoom has a feature to try and focus on that it moves. So it's very hard to stop. But try and go back several feet. It may work. Ramesh does sit like 3-4 feet away. Then it works.
If you go to your Zoom settings, there's a toggle for auto framing that you could turn off as well.
Oh, cool. Yeah, show him how to do that because I don't know how to do that.
Let me also join on my phone because I know how to do it on my computer.
Yeah. Or if you want to share your screen, you can easily share your screen. It's not an issue.
Me?
No, just to show him. If you want to show him how to do it.
No, I'm saying I don't know how to. I don't know if it would work like on my hold on. Can you see? Oh, sorry. Can you see the settings where it says video and settings or no?
No, we are just seeing your
The
desktop
desktop.
only.
Okay. Let me do this.
Display.
Yeah, he show you on your phone where to disable that, Narendra. So you watch what she shows you, then in your phone, you go into settings, and then there'll be somewhere she'll show you where you can turn off the
So you are going
auto.
on a video settings?
Yeah, on Zoom, so next to where it says video, there's that up arrow. I sent a photo in the chat. And in the chat, you see I have it toggled off where it says auto framing.
Oh, yeah.
Yeah,
Oh,
that
wow.
toggle, that you have to turn off.
All right. So Narendra, what you do is, when you look at the camera and the microphone icon on your phone at the bottom on Zoom, Narendra, when you look at Zoom at the bottom left, you've got the phone, the microphone and the camera. You can turn on off if you want. You see that?
1 minute.
Oh,
Devendra, I do one thing only, just take a screenshot and send it them. Okay, so I think that will help.
In videos.
I can't hear you properly.
We have
Yeah,
to go
so
in
it is in a video settings. If you click on a video, then
Oh, echo, sorry.
yeah, and then after you click on video settings, and under the appearance tab, that is auto framing.
background.
Not
Then,
there.
what we say, Narendra ji, you can give just instructions and all other people will follow.
Yeah,
Okay.
don't show us. I think that'll be easiest.
Yes, it is not when you are showing, then automatically the voice becomes part for the phone.
Okay.
Yeah, just describe it. I think that'll work better. Then I'll show you when I'm with you. Now I figured out how to do it. I'll show you how to do it next time.
You can give just instructions. That is enough.
So
But Narendra, instead of doing it, just tell us what to do. Just don't do it. Just tell us what to do. It'd be easier. Come to the phone and then just tell us like a lecture what to do. That would be easier. We can hear you better.
You can hear?
Yeah, perfect. Now just tell us the steps. You don't have to do them yourself, and then we can follow along.
Put your left heel on top of your right thumb toe and bend the leg towards the left side and the head, chest and the face facing right side. And try to touch both the feet on the left side on the ground. Then come back. Now put the right heel on top of the left toe and turn towards the right side. The feet touching the left side and the chest and the head facing left side. Then come back. Now bend the right leg in the V shape and bend towards the left side and chest and the head towards the right side. Then come back. Then raise the other left leg in V shape and turn towards the right side. The left knee touching the left ground, right side ground, and the chest and the head facing toward the left side. Then come back. Then bend both the knees, legs on the knees, and turn both the knees toward the left side, and the chest and the head towards the right side. Then come back. Inhale, then exhale, and put both the feet toward the right side and the chest and the head toward the left side. Come back and relax. Did I miss anything?
I think you have done well done. Yes. So when we are turning, we have to turn slowly without giving any pressure to our backbone or waist. And also we should try to raise the waist part as much possible as, okay? So that will give good twisting to your body and backbone. Okay. So like whenever we wash any clothes and we do like this, okay, so this is the twisting.
Twisting
This type of twisting we have to give to our body like this.
Basically, we have to twist from the waist. So
yes. So we have to raise the waist part towards the opposite side as much as possible.
Okay.
Yeah. So the Suresh Dada, here Suresh Ji is Chitalia, the father of Devang Bhai. He was going to for surgery for his back pain. And Sabniji told him that first you have to do this exercise and then you have to think about it. After 3 months, I think the pain is gone. No surgery was required. So till today, he is now 86 years old. Even after 30 years, he is not feeling any kind of back problem. Just by this backbone exercise.
Also, Samniji, I had a little bit of back pain and light flare on the flat surface on the ground, on the carpet for nearly 5 years. Now I hardly have any back pain.
Correct. We are sleeping on a very soft beds. They are creating actually the problem because the backbone goes sometimes in the what we say inside the bed, and that's why there is a problem of back. If you are sleeping on a hard floor or hard piece of wood, you will not feel that kind of problem. So yes, thank you very much for giving wonderful exercise. Yeah.
Nice job.
Okay, thank you. So Dr. Devendra, I have sent one message. You can see and respond me.
Will do, Samiji, yeah.
Okay. Thank you.
Okay, Vandamino
Bye,
Samiji.
Bye, everybody.
Vandami Naman Samiji. Thank you, Mehta.